Hi, I'm Dr. Dean. I'm an eye surgeon working in Nelspruit and Bombela, and today I want to talk a little bit about floaters. So floaters are very common. Many people suffer with floaters. Some people have them and hardly notice them. Some people have hundreds of them and they're very disturbing to the vision. And so the question is normally asked how to treat these. So the main way to treat floaters is with vitrectomy surgery. So to do what we call a floaterectomy, where we remove the gel where the floaters are. Now, because floaters aren't sight-threatening, they don't threaten your vision, they don't cause blindness, not all patients need a floaterectomy. There are other options in treating floaters. Some patients have tried eye drops that constrict the pupil, things like pilocarpine. They may help a little bit, but they don't remove the floaters and they don't remove the symptoms completely. Other things that can help is laser vitreolysis, where a YAG laser is used to laser the floater. What that does is it doesn't get rid of the floater, it just splits the floater up into smaller pieces, and often that can be more tolerable from the patient. But really, to get rid of floaters, one has to remove them from the eye with vitrectomy surgery. And so when patients ask whether they need surgery, the question I ask is do you think you need the surgery? And the reason I say that is it's the patients that is experiencing the symptoms. Only they can know how disturbing or how frustrating or how annoying the floaters are. Because they're not sight-threatening, they don't cause blindness, it depends on what that patient is experiencing day to day, on whether it's bothersome. And some people, it doesn't bother them that much. Other patients, it's really bothersome. So it's really not up to the surgeon most of the time as to say whether you need surgery, but really depending on your lifestyle and your needs and how annoying they are really determines how symptomatic they are, determines whether you need surgery. Certain scenarios, I've had patients that are tennis players, for example, who have a large floater that keeps coming into their vision while they're playing tennis, and it puts them off their game and they can't play tennis. And that person becomes really important to remove the floater, where the same floater in another patient may not bother them at all. And for that patient, they don't need surgery. So it's really depending on you and how much they bother you. With anything, like any surgical procedure, you always have to weigh the pros and cons of surgery. All surgery have some risk involved with them, and so weighing up the risk versus the benefit determines whether any surgical procedure should be done. If you have a retinal detachment, without surgery, you're going to be blind, and so the benefit way outweighs the risk with retinal detachment surgery. With the floaterectomy for floaters, the benefit is having less floaters and having a clear vision. The risks of surgery are the risks of surgery, and so the benefit can only be determined by the patient. And sometimes patients find that frustrating when I say it to them, because they want me to say whether they need surgery or not. But really, that's the truth. It depends on how much they're bothering you. Listen, modern retinal surgery is safer than it's ever been, but it's not without risks. Risk of infection, risk of post-operative, what we call urban gas or CME, swelling in the retina can occur, and very occasionally a retinal detachment post-floaterectomy can also occur. So there are risks involved with doing any surgery, and so one has to be sure that the risks outweigh the benefits. It's also important to understand that sometimes floaters can improve. They may not disappear completely, and especially when floaters first occur. So if you get a posterior vitreous detachment, okay, so this is the typical scenario of what we call a posterior vitreous detachment, where the gel pulls away from the back of the eye, and this is normally when people get acute onset of floaters, and they suddenly get floaters and they notice these proteins that are floating around in the jelly of the eye that are bothersome. Often, as this gel pulls away more, these floaters can move down, they can move up, they can move out of the visual axis. And if they move out of the visual axis, patients don't notice them. That's the first thing. The second thing, there's a certain amount of neuroadaption. What that means is that your brain starts to ignore them. The same way that in your vision in both eyes you have a blind spot. That blind spot you can't see. Although it's there's a big black spot in your vision, you aren't aware of it because your brain has filled in that space. What happens with floaters is very similar. You can get this neuroadaption and they don't bother you anymore. So if a patient has an acute PVD, means they've just developed a vitreous detachment, they've got new floaters, normally the first week it drives them crazy, but normally when I follow them up a few months later, they say the symptoms are almost gone or have reduced, they're not bothersome. So there's also important not to rush ahead and have surgery. Give it some time, see if the floaters settle. If they're not bothering you as much, often they can settle down and then one doesn't require surgery. But if they are bothersome, if they're large, if they're affecting your lifestyle, then a PPD or vitrectomy with a floaterectomy is definitely indicated for you. I hope that was interesting. I hope that was helpful. If you need any more information, please give us a shout and we'll try and help. But thanks for listening.